Now, the one thing with this one is that it's much harder to catch. And we've had it for a long, it's been around for a long time. People are very familiar with it. So, I hope it's fine. All I can do is everything that a president can do, which is actually somewhat limited. But it seems like it is not easy to spread. And we think we're in very good shape. We're very careful. And Nebraska has done a fantastic job. They have a place there that those doctors are unbelievable.
That's President Trump in the Oval Office addressing the recent cruise ship Hantavirus outbreak. After 18 passengers arrived back in the U.S., 15 people are currently being held at the University of Nebraska Medical Center's quarantine facility. One patient in the biocontainment unit. 2 additional patients are at Georgia's Emory University, one showing symptoms, while the other was in close contact with the primary individual. 6 other states currently monitoring citizens with reported exposure to that virus. Joining us now is family and emergency medicine doctor and Walter Reed physician, Dr. Janette Nesheiwat. Dr. Janette, great to see you this morning. Thanks so much for being here. And we've got so many exciting things to talk to you about with regard to AI, yes. But let's start on this Hantavirus. What do we need to know about this virus?
Yeah, so good morning, Maria. Great to be with you. And I totally agree with President Trump. We are in very good shape. This is a virus that is very difficult to catch. That's because unlike measles, unlike the flu, unlike COVID, it has a low replication rate. That means it can't easily spread from person to person. And it wasn't built to spread from person to person. On top of that, it's a stable virus. It doesn't mutate like we saw, for example, with COVID mutating, and has a very short window of spread. So that's why we're only seeing 1 or maybe 2 cases in the entire United States at this time. So we are in good shape, and this is a very well-controlled, finely tuned situation that we see by our president and by his administration to keep Americans safe and healthy.
Yeah, Liz.
I think, Doctor, after the COVID outbreak, obviously any new virus kind of sets off alarm bells. And I guess people are a little surprised that these passengers were allowed to get off the ship and go sort of anywhere they wanted in the United States. And thank heavens they're being monitored in these various states. But are you surprised that we haven't come up with a new way of containing these outbreaks on cruise ships? Because it seems to happen with some regularity.
Yeah, well, actually, this, Liz, this is a rare situation. We don't tend to see specifically with hantavirus spreading from person to person. And this is exactly why the CDC listed this as a level 3 response activation. That means it's not a general threat to the public. However, the CDC is still monitoring, responding with surveillance, with testing, and they're doing the right thing by isolating these patients that we're seeing in Nebraska, checking their vital signs every day, every few hours, checking their temperature, their blood pressure, their oxygen levels, their heart rate, to make sure they don't have any early symptoms so that they can intervene quickly and provide supportive care. Because unfortunately, this has a very high mortality rate, up to about 40%. So with the steps that they're taking, the precautions that we're taking, I think we're on the right track and they're doing the right thing. But as always, I always recommend to my patients, depending on where you're traveling to, take precautions, know where you're going, know what the disease outbreak is in that area. And here in the United States, you know, if you're going to be cleaning out the garage, the barn, the attic, don't ever sweep or vacuum dry debris. Wet it first, disinfect it first so that it doesn't aerosolize. So those rodent droppings don't aerosolize, so you don't breathe it in and you don't pick it up yourself. So some basic steps that we can take to protect ourselves.
Yeah, this is very important because people don't realize that, you know, you don't know what you're doing. If you're cleaning out a garage, you're cleaning out the basement, if there are rodent droppings there. There seems to be similar symptoms here to the COVID-19 virus, but most are saying we don't have to worry about a major outbreak. Tell us about the symptoms of the hantavirus, how to treat it, and who's at risk. Real quick, I want to move on to AI, but we'll wrap this up with you assessing who's really at risk here.
Sure. So anyone can be at risk if you inhale it. What we saw, the first 2 deaths were elderly. So usually with most diseases, if you're a vulnerable population, elderly, or have an underlying medical condition, you at a higher risk. The symptoms similar to the flu initially: fever, body aches, chills, you know, sometimes chest pain, sometimes shortness of breath, and that's when it gets worse, and that's why you need immediate intervention.
Okay. Dr. Nesheiwat, let's talk about AI. This new technology developed by the Mayo Clinic was able to detect abnormalities on patients' CT scans up to 3 years before an actual pancreatic cancer diagnosis. The model found to be 3 times better at identifying early signs of pancreatic cancer. One of the biggest killers, cancer, pancreatic. Over 67,000 diagnoses of pancreatic cancer expected this year, including 53,000 deaths. This 5-star survival rate, just 13%. What can you tell us about AI and pancreatic cancer in America?
Sure. So this new radiology AI technology is truly, truly life-saving, because what the researchers did was they looked at thousands of CAT scans, and using this AI radiology technology, they were able to pick up 73% of the cancers up to 3 years early. And that is incredible and possibly life-saving and life-changing, because of the fact that, Maria, 85% of patients who are diagnosed with pancreatic cancer, by the time they find out they have it, it's already spread. It's too late. So imagine if you're catching it up to 3 years early. That means early intervention, and that can change the mortality rate from 12 or 13% up to 40 to 50%.
Well, that's huge. I mean, I know the marriage of technology and medicine, you know, goes back a long time at this point. We've been covering this and studying this for 20 plus years. But this seems like a pivotal moment in terms of AI and its impact on cancer. How does it work?
Yeah, absolutely. So what it does, what this red mod technology does, it picks up molecular and biological changes in the tissue. We're not talking about picking up big, massive tumors. We're talking about microscopic, tiny changes that the human eye cannot see, that the human eye can miss. So if they pick it up early, that means you can, you know, for example, get a biopsy early, have a surgery early, intervention with radiation, chemotherapy. That's how it's saving lives, especially because of the fact that there are more than 52,000 deaths every single year. This is one of the deadliest cancers we see. And, you know, speaking of radiology, speaking of radiology, our very own Dr. Nicole Saphier is a radiologist. She's chosen to be our next Surgeon General, so I'm sure she's very thrilled about this, and she's going to do a great job spreading the message of safety.
Do most hospitals have this AI technology to put to use with regard to pancreatic cancer uses?
Yeah, great question, Maria. Actually, it's still being studied and researched, hopefully within the next couple of years, in addition to new medications that are going to hopefully be FDA approved soon, like Draxonrasib, that we might see, you know, the mortality rate, the survival rate increasing and the mortality rate decreasing. Some of the same technology and medications that former Senator Ben Sasse is using now and has seen improvement.
Janette, it's great to see you this morning. We so appreciate your experience and knowledge on all of that. Thank you, Dr. Janette Nesheiwat. We'll see you soon.